Hello everyone, my name is Jacqueline O'Hagan and I am a clinical psychology doctoral student at the California School of Professional Psychology at Alliant International University here in San Diego, California. Today we are going to be looking at a skill from DBT or Dialectical Behavioral Therapy called Emotion Regulation and Opposite Action. But before we begin, what is DBT anyway and where does emotion regulation fit into it? DBT stands for Dialectical Behavioral Therapy, as mentioned on the previous slides. Dialectical means that two truths can exist at the same time, just like these optical illusions. What do you see? In the first one, we see a face and a vase. In the second, a duck and a bunny. Both images are neither right nor wrong, but both sides are needed to create an optical illusion. In DBT, we are often looking at balancing both the idea of change and acceptance. On this slide, you can see the four components of DBT. On the acceptance side, we see mindfulness and distress tolerance. On the change side, there are emotion regulation and interpersonal effectiveness. Just like the optical illusion, we can hold two ideas at once. The idea that we must accept where we are in our current state and also want to change it. This can be a delicate balance, but just like balancing on this fulcrum, sometimes we might feel more weighted on the acceptance side and sometimes on the change side. Creating this balance allows us to make some space in our lives. For example, let's say you've gained some weight due to life stressors, such as a big event at work, you are busy taking care of someone, or even grad school. We accept that we are at the weight we are, and we want to set a goal to change it. Notice that throughout this example, I was saying that I kept saying the word and instead of but. This is an important part of dialectics to make sure that we are giving recognition to both sides. By doing that, we are able to get back some power to the situation and recognize that this is not where we may want to be. So where does that put emotion regulation? Over here on the change side. So what is emotion regulation? According to Dr. Marsha Linehan, who created DBT, emotion regulation is the ability to control or influence which emotions you have, when you have them, and how you experience and express them. Regulating emotions can be both automatic as well as consciously controlled, just like breathing. We may not be able to control the initial reaction of the emotion, but we can control how it affects us. In order to do that, we need to be able to identify what emotion you are having. This alone might be difficult for many people because our society typically doesn't teach us how to connect with our emotions until a consequence happens, such as breaking or throwing something after an argument, and then we realize how angry we were. Dysregulation occurs when these emotions become too overwhelming or are out of control. Being able to regulate these emotions empowers us to make decisions and get our needs met. Using the emotion of anger, we may feel angry because we aren't being heard, so we yell louder to get people to notice us. While some anger can be beneficial, if we are a 10 out of 10 on a scale, we have become dysregulated. Bringing the emotion back down to a 6 can help us firmly ask for what we need. Notice that the anger is still there, but it is controlled and more effective. Lastly, this is a skill that takes a lot of practice to master and a lot of mindfulness to be aware of how we are feeling in the present moment. It is important to say that emotion regulation is not trying to be happy. There is often a misconception that the skills that are taught by therapists are just so we can be happy. Notice that in the previous example that the anger was still a 6 out of 10. It didn't disappear, we just regulated it to become more adaptive. This is the concept of the change side of DBT. It also means that the emotions don't matter and that we are trying to dismiss them. Emotions are a way of life and very much needed to survive and connect with other humans. It is not an instant fix. It takes a lot of practice to be able to first identify your emotion, then recognize what you need in the moment to change. The goal of opposite action is to change an emotion's action and expressive components by acting in a way that opposes or is inconsistent with the emotion. Opposite action can do more than just make someone happy who is angry. It can be used in behavioral activation for someone who is severely depressed by getting someone who wants to isolate out of rumination and call a close friend to talk to them. Or for someone who has no energy due to sleeping all day, get them out for a 10-minute walk. It can also be used when the primary emotion is fear for the use of phobias in exposure-based treatments. A person who might be afraid of spiders can, for the most part, get through life pretty okay. But let's say a person who has a fear of crowded places due to a traumatic event will often create a world in which they avoid doing anything that involves lots of people, which can have an impact on their way of life. So when are we choosing to use this skill? We must first check the facts, which means checking to see if what we are feeling and thinking truly matches the event, or if we are reacting to our interpretation of what is happening. If our cued emotion does align with the facts, but if you act on your emotion, will it be maladaptive? Then use opposite action to shift the intensity to a lower level so you can process what is actually going on in the room. Lastly, are you engaging in a behavior that either doesn't align with your values, or are you trying to correct a maladaptive behavior such as isolating when depressed? With that being said, let's do some practice, which is also a big component of DBT, and go through these steps together. Step 1. Identify your emotion. How are you feeling right now? What emotion is the most present in your body? Just take a moment to see where you are. Got it? Great. That is the first step. Our emotions stem from the 5 core emotions of joy, sadness, fear, disgust, and anger. Us humans are complex creatures and have many different emotions and words to describe how we are feeling, but for this presentation, we are sticking to the 5 core emotions. Step 2. Check the facts of the situation. Is this actually what's happening, or is it my interpretation of what is happening? Step 3. Identify and describe your action urges. What is this emotion making you want to do? Are we angry and want to scream and yell and throw something? Are we depressed and not want to get out of bed? Are these urges or actions helpful? Will they make the situation better or worse? This slide helps show what our emotion is and their opposite action. If we fear something, such as a phobia, we want to approach it and challenge what we are afraid of. When angry, we need to distract ourselves, or if our anger is due to an interaction with someone, we want to disengage and leave them for a bit to cool down. If we are depressed and sleeping a lot, we want to get up and moving. Disgust is much like fear, where we want to approach it head on. Disgust can either be a person, food, or situation. While love is seen as a positive emotion, if we are too invested in either someone or something, it might be good to take a step back from it. Absence only makes the heart grow fonder. Step 4. Be like Nike and just do it. That's great, Jacqueline, but what does this look like in real life? You recently got a new job and are attempting to fill out a link that was sent in an email. It is not working, and so you try different browsers over and over on different devices. You are now an 8 out of 10 screaming and yelling at the computer. What is your plan of action? What is your opposite action? You've been practicing your mindfulness skills and realize that you're experiencing anger, but it is not helping to keep screaming. You decide to close the laptop, put it away, and go watch your favorite comedy movie. You are able to come back later and send HR an email stating that it was not working. Notice that the goal wasn't necessarily to try to make you happy, but to lessen the emotion to be able to problem solve and think in a clearer mind. Let's do another one. When you were little, you were bit by a small dog on the hand and have been afraid ever since and have actively been avoiding dogs in public. While it can be inconvenient, it hasn't affected you too much while in your daily life. You start dating someone who has a dog who they say is super friendly and loves to cuddle. What is your opposite action? You realize that you can't avoid the dog forever, and your partner has expressed some frustration since they would like you to come over to their place. So you once again use your mindfulness skills and do some deep breathing exercises. You decide that you are going to approach the dog, but while your partner has them on a leash, and gradually work up to petting them. You were able to confront the thing that you have been avoiding and hopefully, with more practice, conquer your fear. But Jacqueline, I tried it and it didn't work. Now what do I do? Well, you want to reevaluate and check. Did the emotions not fit the facts or the situation? We might have to recheck and see if that was truly the emotion or a secondary one. In our second example, were you mad that your partner was asking you to do this? Then you would be trying to use opposite action on anger rather than fear. Next, did you fully commit to doing the opposite action, or did you just try it a tad? For our first example, did you walk away for 5 minutes and then come back? That would not give you enough time to fully disengage from the situation. Don't forget that it takes time to practice being in tune with your emotions and to be able to understand what you need. It might take some practice to see what works and what doesn't, but don't give up. You've got this. I would like to thank you for watching this video. If you'd like to learn more about DBT, ACT, and other cognitive behavioral techniques, please check out the CSPP Third Wave YouTube video channel.